Hey guys, it's Dr. Justin Marchegiani here. We got a phenomenal live Q&A here going. We just finished a podcast on detoxification and binder support. So if you haven't seen that, make sure you check it out. We really want to see all your comments below. I want to know what you think. Give us some ideas of future topics that you want us to address. And if you're enjoying it, smash that like button, thumbs up, share, hit the bell so we get in your notification reel. We appreciate it. All right, let's dive in. What is going on? So with the last podcast here, we chatted a bit about binding support, which can be really helpful to essentially put a straitjacket on a lot of the critters. So we talked about activated charcoal and bentonite clay and when it should be taken. We talked about some binders that are beneficial to for mold. We have mold, and we talked about glutathione and sulfur amino acids to upregulate detoxification, phase 1 and phase 2, cytochrome P450 oxidase pathway. We talked about those as well. So if you haven't seen it, feel free and subscribe so you have access. All right, so we got a live Q&A action here. I didn't put this link up too soon, and this is a holiday weekend, so we may not have a lot of people on here today, so feel free and chime in if you guys like. I'll give you a few minutes here to kind of get into the Hangouts. What is going on in the health world today for y'all? What is happening? Let me know. Facebook as well, same thing. Let me know. Make sure you guys check out the previous podcast we just did a few minutes ago. All right, so a couple of things I want to chat about from patient calls last week. So a couple of things I want to highlight. Let's see here. What's a memorable patient issue from last week? There's a bunch. They all kind of blend together over time. But in general, I would say I'm seeing a lot of patients that are having high levels of TSH, but their thyroid hormones look reasonable. This can happen sometimes. So when I see high levels of TSH and adequate thyroid hormone, it's a combination of number one, HPA axis dysfunction, or HPT axis dysfunction, meaning hypothalamus pituitary in the brain, talking to the adrenals or talking to the thyroid. And it can happen from adrenal stress. Adrenal stress can raise cortisol or create cortisol imbalances where the hypothalamus has to yell a lot more, and it has to chronically yell to get the thyroid to do what it does. So think of it as you having to yell to get your kids to make their bed or clean up after themselves. Ideally, we want to just be able to speak to them in a normal way so they can do what they got to do. So we want to communicate more sustainably. And when we have high TSH and adequate thyroid function, we do want to bring that thyroid function down a bit. So we're going to use specific adaptogens. We're going to make sure the adrenal stress is supported. And we may use, depending on how high the TSH is, we may use some actual bioidentical thyroid support. It depends. But when we see high levels of TSH and adequate levels of thyroid, I just want to get everyone to think about adrenals, think about HPT, HPA, access dysfunction. Those feedback loops need to be worked on, reestablishing them. All right, so let's dive in here, guys. I got some questions that popped in. Pink writes in, I'd like to see a show about how to handle illnesses that have posting protocols. So regarding protocols, I mean, everything's going to be specific and requires a lot more information typically than what we can get on a quick live YouTube Q&A. So it's really hard to do that just because of how much in-depthness it takes to get that information. But we can go over general things for sure. Robert writes in, Dr. I have a yeast overgrowth athlete's foot. Thrush, my stool test came back negative. Blood test for Candida mannin also negative according to our Slovak ranges. So when we look at Candida is really hard to pick up on a stool test. So we have clinical signs and symptoms. Clinical signs and symptoms could be tinea versicolor rash. It could be athlete's foot. It could be jock itch. It could be thrush. It could be dandruff or seborrheic dermatitis in the hair. All these things could be potential signs of Candida. So we don't necessarily need the lab test diagnosis. Clinical diagnosis is fine as well. And sometimes it may not get down into the gut and move out through the stool, and it may be harder to culture. We also may look at diarabinitol in the organic acids because that can give us a good window of systemic Candida as well. So diarabinitol is also very nice. And we may even look at how our immune system is responding and do a Candida IgA, IgG, IgM and see how that comes back. So those are the big things that I would be looking at. Marshall writes in, I'd like to know if low stomach acid can cause histamine intolerance or if nutrient deficiency can cause histamine intolerance. Yes, it definitely can. So one of the big nutrients that's needed to make hydrochloric acid is zinc. So if we have low zinc, that can cause low hydrochloric acid, and that may drive more histamine intolerance. So zinc is a big one. If we have lots of stress, that could be impeding our parasympathetic nervous system response, which is needed to make hydrochloric acid and enzymes. So all of those things, all of those factors are potentially connected for sure. They're all potentially connected. We have to look at getting to the root cause, but inflammation can definitely drive histamine issues. Think of your histamine bucket. The more inflammation we put in that histamine bucket, the more likely that food histamines or environmental histamines can become a factor. Leaf writes in, can you give advice for Crohn's patients? So yeah, with Crohn's patients, that's an autoimmune condition that affects the small intestine and colon. You're going to see skip lesions. You're going to see tons of inflammation, maybe bleeding. You have to get to the root cause. So of course, I've had great success with Crohn's patients, but you have to get the diet dialed in. Typically an autoimmune template's a great starting point. You want to work with a functional medicine doctor because there are probably a lot of other nutritional deficiencies if you have chronic Crohn's that has to be looked at and addressed. And there may be other underlying bugs, gut bugs that could be present as well that's driving the inflammation. So it's multifactorial. A condition like that, you want to have a good functional medicine practitioner in your corner. El Guerrero writes in, I reduced inflammation and up nutrition before treating SIBO with herbal antibiotic, but did not take a binder while treating. My lymphatic system seems swollen. Anything I can do? Yeah, so I would be following my ginger tea recipe. You can go to my website, justinhealth.com, and Google that and be following the ginger tea. That's going to be very helpful because ginger is a natural anti-inflammatory. It's a natural anticoagulant. It keeps things moving. And if you're a patient too, I'd also be following my die-off reaction handout where you gently titrate up and taper up the clearing herbs so you are not overwhelming the system with throwing too much dead debris in it, right? We got to be careful. We got to titrate it up so our body does not get overwhelmed. All right. Hope that helps. A couple other things. A couple patients in the last video had some questions as well. One question I saw was, if I'm taking clearing herbs, can I take the herbs twice a day? You can. So typically we recommend 2 capsules 3 times a day with a lot of our formulas. So you could do 3 in the morning and 3 at night. That's totally fine. Some people that's too much, meaning like there's just too much herb at one time and you could cause more die-off like that. So as long as you can handle that, I'm fine with it. Sometimes spreading it out can be a little bit better. And of course, you can always do the gingers like the low-hanging fruit because ginger does a couple things, anti-inflammatory. It also is an anticoagulant, but it also is a biofilm buster. So it helps remove those shields that a lot of the bacteria use to protect themselves from antimicrobials. So we like that a lot. Okay, we like that a lot. Any other questions, guys? Feel free and let me know. So that was a big one, was the clearing herbs. Now, a lot of patients of mine that I see chiming in here, they may have die-off reactions. And the biggest component with that is giving your body an on-ramp to ramp up some of these clearing herbs so you're not coming in all at once. It's kind of like dipping your toe in the water to see what the temperature is before you test it with 2 feet, so to speak. So we want to dip the toe and then you can ramp it up slowly. So doing a combination of a gentle titration up is very helpful. And then also adding in ginger and potentially binders may be very helpful as well. So you really want to have binders potentially, but at least the ginger and at least a good ramp up. And then we can always add in binders after the fact. Sylvia writes, not taking estrogen pills still cause kidney and gallbladder stones after years after disconnecting. It's probably not the root issue, but I wouldn't be surprised that if there may still be estrogen dominant issues if you didn't get your hormones fixed. A lot of women go on birth control pills for off-label uses, not just pregnancy prevention, but they have a lot of hormone symptoms to begin with. And that may be a symptom that you are noticing. You're just having a lot of hormonal issues, and there's probably estrogen dominance present that needs to be looked at. Is MCT oil effective for killing candida? Well, what you're probably referring to is caprylic acid, which I think is C6 or C10, and that has antimicrobial qualities to it. So yes, that would have good candida killing qualities. I would not recommend only using that to wipe out candida. I would also be using other types of herbs to knock it out. So in my line, we'd also throw in GI Clear 5, which is a emulsified oil of oregano. We may throw in GI Clear 6 that has Podiarco in it too, or even silver. So that could be one component that maybe you throw in your coffee or tea. That's totally fine. Marshall writes in, best zinc supplement to take with histamine intolerance. I mean, a zinc aspartate or a zinc chloride, any zinc that's bound to a good mineral. Like if you look at my multi-support pack or any of those type of good multi-packs where they're bound to like amino acids or minerals, you're going to do great with that. A lot of the great companies use a lab called Albion Labs, and they license from them, and they use a lot of minerals that are bound to amino acids for maximal absorption. That really helps a lot. It just gives it just an easier uptake into the body. It's kind of like an escort into the club, so to speak. You kind of pass the waiting list in general. All right, cool. Any other questions here on Facebook, guys? Let me just check my chat over here. Anything you want to chime in on, let me know. But regarding die-off and regarding killing herbs, one of the best things you can do, it's kind of low-hanging fruit, is going to be the solution to pollution is dilution, okay? Getting more water in dilutes a lot of these toxins. It provides nourishment for the kidneys, allows the kidneys to work better, flush out the junk. So that's going to be super helpful to keep things moving on out of the body. That's number one. Number two, ginger is going to be really helpful keeping the inflammation down. Inflammation causes cells to agglutinate and get sticky and not move through the system as well. So the more we do that, that is great. Cyprian writes, Dr. J, is Great Lakes gelatin, collagen, protein high quality? I think it's pretty good. I mean, if you compare it to mine, my brand is True Collagen. The difference with mine is, well, number one, I get mine from Argentina, so it's grass-fed, it's high quality. I think Great Lakes maybe, but the second thing is how we treat it. So we use proteolytic enzymes. So proteolytic enzymes are typically not the norm. Usually sulfuric acid is added to it to break it down. So we use proteolytic enzymes. One, you get less of a sulfury taste in the amino acids when you mix them in tea or coffee and such. So taste-wise, it's good. And then just the proteolytic enzymes, in my opinion, break it down better. So it's just better absorbed on the back end. So yeah, collagen's great. I think Great Lakes is a good, kind of intro way to get in there. I'm not sure it's the best, but starting out, I think it's good that you have it than not. So that's great. Let me just jump in here on Facebook. Is gastritis a symptom of something else? Well, let's break it down, right? Gastritis just means gastric inflammation, AKA stomach inflammation. So now, why is the stomach inflamed? Is it a food issue? Is it because you can't break the food down? Is there an H. pylori or SIBO issue? So typically it's going to be one of those three. It could be all three. It's possible. So you have to get to the root cause. Citrus, coffee can be a flare. Is it a food? Are you not breaking down that food? Is H. pylori or other infections a stressor? So keep those things in mind as a root cause perspective. A good functional medicine doc will help fret that out with you. El Guerrero writes in, is ginger tea and Motilipro okay to take together, or is that too much ginger? No, it's okay. I would have no problem with that. But in general, just add them one at a time so you can see how each one does. The ginger is going to be great, and it's going to be really anti-inflammatory. The Motilipro has ginger in it. It also has B6. It has carnitine, and it has 5-HTP, which all help with that migrating motor complex. Ginger is also a natural prokinetic. So if you have slower gut motility, it can kind of gently move things around. Kasha writes in, I'm dealing with gut inflammation along with candida. I've noticed a pattern where I have lots of energy and feel great for a day or two. Yeah, so that's great. That's more than likely a good sign, a good sneak preview of what's to come more frequently. Followed by feeling bad, mucus in the stool. Yeah, mucus is just a sign of inflammation. My diet's very clean. Not sure if I should focus on killing the bad, growing the good with probiotics and fermented food. Yeah, so you definitely want to make sure that you are killing the candida, but you also want to make sure it's not just candida. A lot of people have candida and blasto or candida and H. pylori. So you want to make sure that you are addressing everything together for sure. Laura, you're totally welcome. Thanks for the great question. My endo is normal, but still burn. Alkaline diet. All right, good feedback. Yeah, feel free and reach out, Laura. Great questions. Sarah writes in, a few months ago, I broke out with acne on my cheeks. My face is currently mostly clear, but the red inflammation from the past acne is still there. Why and how can I get rid of it? So yeah, make sure the gut is fixed. Make sure you have that dialed in. Now, one of the things that I use with post acne or post skin redness from irritations or trauma, whatever that is, we're going to use high quality vitamin A and vitamin C topically on the skin. That's going to help the collagen regrow. That's going to help the repigmentation, all that good stuff. So one of the lines that I use is Marie Varnick. We'll use the vitamin C and ferulic acid, and I'll use the vitamin A retinol night cream. Those are excellent to use to provide extra antioxidants. And then feel free and let them know that I referred you over there. I appreciate that. Sylvia writes in, how dangerous is enlarged lymph nodes near the navel and what herb to use? So it just depends, right? Anytime we have lymph node, if it's tender or painful at all, I mean, that's actually a good sign because typically cancer is not painful. You don't feel it. But number two is it's natural to have the lymph get congested. You have macrophages, little Pac-Men and women in the lymph. They gobble stuff up, and then you can see that get swollen. So you want to get to the root cause, like of supporting the immune system, supporting the bacterial killing, so you can get rid of the bacteria. And then ginger is a real easy one to support the lymph. Red root is going to be excellent as well. Alamo writes in, getting low body temp often, which makes me feel rough, 35.5. Yeah, I don't know the Celsius conversion on that, but 35.5 to Fahrenheit. Let's see. Yeah, so that's 95.9, 96. That's low for sure. Sounds like you may have some hypothyroid stuff going on. Got to get to the root cause of that. Typically, there's a gut component, an adrenal component, a thyroid, maybe an autoimmune issue too. But that's it. Doing good temperature testing can be a really helpful sign of what's going on with your thyroid. Because one of the first signs of low thyroid function is low body temperature, right? So your thyroid sits here. It's going to be that master thermostat of the body. And we like to be 97.8 to 98.2 in the armpit, in the axillary area, or 98.2, 98.6 in the mouth. And that's kind of a good general idea of where you should be. And a good sign that you're off could be that. Now, I like to use digital fertility thermometers to assess that, make sure it's really accurate, and do it once or twice a day. That can be helpful. Sylvia, you're totally welcome. Sarah writes in, do you like the Genova GI effect stool test? I do not like it. You're welcome, Ali Mo. Carlos writes in, what's your take on B3 deficiency causing low stomach acid? Well, I mean, B3 is niacin, right? I think niacin is an important B vitamin. Typically, you're going to get it, Carlos, if you're taking like a good multi or like a good B vitamin support. A good multi will have it as well. And if you're eating nutrient-dense, high-quality meats and lots of vegetables, then you're going to have additional B vitamins there as well. So if you're taking it in a good multi and you're also eating lots of good leafy greens and healthy meats, you're more than likely going to be fine in that. And feel free to run your foods, Carlos, through a chronometer just to double check. But I guarantee you're many times over the limit. Monica, any suggestions for hair loss? So if you're a female, I'm guessing by the name, you want to look at the thyroid and you want to look at the gut. That's important. Thyroid hormones are really important for stimulating hair follicle growth, but also you need building blocks from your gut, protein, fats, so you can have those raw materials to make hair as well. Rhonda writes in, what are optimal hormone levels from menopause? Saliva test shows I have estrogen. I have low estrogen, testosterone, and DHEA, supplementing with progesterone cream because those levels have been low in the past. So it depends. Like we're going to be doing specific Dutch hormone testing. We're going to look at your metabolites, and it depends. Typically, I want you in the upper part of the menopausal range, mid to lower on the female hormone cycling range. And it just depends what other kind of symptoms you have. And as we adjust dosing, how they improve or get better over time. What about doctor's data test? Doctor's data test is better for sure. I like the GI map. I like the 401H. Doctor's data is reasonable as well. Those are helpful tests. All right, cool. Laura writes in, I was on the Depo-Provera shot for 4 years, came off 2 years ago, still no menstrual cycle. I have one by now, but I'm also 45. Yeah, I mean, some of these hormones can really dysregulate the HPA axis. So, I mean, I would look at getting your cycle back on track. So it's helpful to test, see where your hormones sit. And there's various protocols that can be done using herbs and potentially using progesterone cyclically to help. It just depends on where your levels are at. You're welcome, Sarah. All right, any last questions, guys? I'm going to wrap up here for today. Hope you guys have a phenomenal holiday weekend. I'll be back later on this week. Really excited to connect with y'all 2 times in a day. I love it. It really recharges me up. You guys are asking some phenomenal questions. It gets my brain moving, so I really appreciate it. Can I take probiotics with magnesium at night, in the morning with thyroid meds? Yes, I have no problem with that, Monica. That is totally fine. And what you got to be careful with, well, with thyroid meds, more than likely you're fine. I know with thyroid medication, calcium and iron should be avoided. So with magnesium, that's tough. I would do magnesium at night and definitely avoid it in the morning with your thyroid meds. But probiotics with thyroid meds in the morning, you should be okay. Which ketone measurement device do I need to check my ketone levels? A beta ketone measurement device. I would use the Keto Mojo. Keto Mojo has the least expensive ketone strips. Then after that would be the Precision Extra by Abbott. That's a good one. But the strips are a lot more expensive. So if you're going to invest, get the one that has the cheaper strips. Oh, my son, his name will be Hudson. By the way, we have a name already picked out. We're sharing it. He will be born in mid to late August. So thanks for asking. I really appreciate it. So we'll have 2 boys very soon. Very excited. All right, guys. Today was phenomenal. Any questions, let me know. I'll be back hopefully for another live Q&A. I will be traveling this weekend, so I may not get to it Friday, but we'll see. I may surprise you all doing a lunchtime Q&A. So appreciate it. Subscribe, like, comment below. Really appreciate the feedback. And you guys have a phenomenal rest of your weekend. Take care. Bye.